Assalamu alaikum, dear brothers, friends, sisters, my elders, my teachers, are all dear friends. This is Dr. Shehzad Arshad, the chairman of Neuropsychology Center, Pakistan. Uh, it's a public service message on behalf of Neuropsychology Center being given to all the people of Islamic Republic of Pakistan and all over the world. Today, we would like to talk about a very important subject which we call as the sleep disorders. Sleep disorders are getting very common these days, especially in Southeast Asia, and these needs to be addressed. So, first I would like to generally explain what is sleep disorder. So, sleep disorders are conditions disrupting normal sleep patterns, affecting the quality, timings, and the amount of rest, leading to daytime impairment and health risks. Common types are, which includes are insomnia, obstructive sleep apnea, which we also called as OSA, and then is the restless leg syndrome, which we call as RLS, and then is the narcolepsy. Symptoms in this disease primarily involves difficulty staying asleep, excessive daytime sleepiness, and usual behaviors during the sleep, which are very unusual behaviors. So the treatment include lifestyle changes, number one. Number two is the therapy. And number three is the medical devices. Common types of sleep disorders. As far as the common types of sleep disorders are concerned, so firstly we would like to say that insomnia, number one, in which trouble falling asleep or staying asleep. Then number two is sleep related breathing disorders, which we called as OSA, means obstructive sleep apnea, which is the airway blockage, and it's a very serious condition, and it's essential sleep apnea. Number three is hypersomnias. Hypersomnias are excessive daytime sleepiness, such as narcolepsy. Then is the circadian rhythm sleep, which we also call as wake disorders, which is disruptions from shift, work, or jet lag. Then there is another type which we called as parasomnias. Parasomnias are usual behaviors like sleepwalking and nightmares. And then is the movement disorders, which basically includes the restless leg syndrome, which we also called in medical terminology as RLS. Now, dear brothers and sisters, we would like to talk about the symptoms of sleep disorders. What are the symptoms? So primarily the symptoms are persistent difficult falling or staying asleep, number one. Number two, extreme daytime sleepiness. Number three, irregular breathing. Number four is urge to move legs, which we call as RLS. And number four is abnormal movements or behaviors during the sleep. And then finally is the irritability, anxiety, or lack of concentration. So these are the important symptoms of sleep disorders. Now, what are the causes and risk factors? Number one is the physical. Medical conditions like heart disease, chronic pain, hormonal changes. These are the physical symptoms. Risk factors, primarily the risk factors. Then is the psychological risk factors. One of the topmost psychological risk factor is depression, which is very, very serious. And then is anxiety, number two. And number three is stress. So these are three important causes and risk factors, which is depression, anxiety, and stress. Then in causes and risk factors, we would like to mention the environmental effects. Number one is the shift work, poor sleep habits, caffeine, alcohol consumption, and finally is the genetics. Family history of certain disorders like narcolepsy, if present in the family history, so that cannot be helped probably. Now we'd like to talk about what are the treatment options. The treatment options are: number one is the lifestyle changes, which means consistent sleep schedules, limiting caffeine and alcohol. Better is the diet. Number two is a therapy, cognitive behavior therapy, which we call as CBT for insomnia, and primarily which specifically includes CBT-1. Then is the medical device and interventions. These are very important subject. Medical device and interventions. So continuous positive airway pressure, CPAP. This in medical terminology we call it as CPAP. These are the machines for sleep apnea or oral appliances. And finally is the medication, short-term use of sedatives or specialized medication. So dear brothers and sisters, my elders, all respectable brothers, this sleep disorder is a very serious issue. If unaddressed, if it is not addressed properly at the right time, it may lead to many complications. So it should be treated and it should be addressed, and for that it's my humble request to all to please consult a professional, which includes a medical doctor, which includes a consultant, which includes a psychiatrist, which includes a psychologist, and which also includes at the same time an internist. So it's a public service message on behalf of Neuropsychology Center, one of the leading neuropsychology centers serving in all over Pakistan since last more than 2 decades. And I would like to say that long live Pakistan, and Pakistan is a great country, and long live Pakistan. Thank you very much, dear brothers and sisters, for listening me for this very important topic, sleep disorders. Once again, I would like to say, long live Pakistan, on behalf of Neuropsychology Center, Pakistan. Thank you very much. For any information further required, you may please contact our website www.npcpakistan.org. I would like to repeat, for any further information, you may please visit our website www.npcpakistan.org. Thank you very much. May Allah bless you all. Long live Pakistan.